Welcome to the Speak Up Youth Voices for Sexual and Reproductive Health and Rights around the world. We are so thrilled that you could join us all the way from Canada, Kenya, Uganda, and Zambia, and the 19 other countries where young people signed up for this event. Before we go any further, I would like to share that you are welcome to turn on subtitles for this event by clicking closed captioning below the video player. Press show to turn them on, and the language can be selected in the bottom corner. I am your host, Lubumbe Jeremiah Mulanda, a member of the Youth Advisory Board from Zambia on the SheSource project. I will be hosting this event alongside the passionate and joyful colleague of mine all the way from Uganda. Hi, Amanda.
Hi there, Jeremiah. It's a pleasure to be here. My name is Amanda Joan Julian Mary Banura, and I'm super excited to be here and to hear from all the young people who have joined us today, especially our diverse and passionate panelists, as they speak up about sexual and reproductive health and rights, also known as SRHR. SRHR refers to people's health and rights when it comes to their own bodies and choices. As Jeremiah mentioned, we are both members of the SheSource Youth Advisory Board. This is a youth-led project that improves young people's access to SRHR information and services in Kenya, Uganda, and Zambia. In Canada, our colleagues, Care Canada's Youth Champions, raise awareness of sexual and reproductive health through Instagram, the SheSource podcast. I love that show. And advocacy.
SheSource stands for Sexual and Reproductive Health and Economic Empowerment, supporting out-of-school adolescent girls' rights and skills. The 7-year project is funded by Global Affairs Canada and implemented by Care Canada and global partner organizations Youth Coalition for Sexual and Reproductive Rights, Restless Development, and the Center for Reproductive Rights. We're working alongside many local partner organizations, healthcare providers, communities, and of course, youth to increase access to SRHR. This is so important because when young people have access to their health rights, they are able to live healthier lives and can focus on what they want to do. Let us start our panel discussion.
Yes, indeed. Our rich panel today has amazing speakers from 4 countries. We have Yasmin Mohammed, founder of Superb CBO in Kenya, a women's rights organization. Hi, Yasmin. And second, we have Hakim Kayonga, the program manager for the SheSource project at Youth Chaperone in Uganda, a youth-led organization. And our third panelist is Annie Nsambu, President Activista Zambia, a social movement. And finally, the one and only Earth Guillaume, a national sexual health and rights.
Thank you so much, Amanda. Let us delve into it. Panelists, beginning with you, Yasmin. Please briefly introduce yourself and share one personal or professional experience where you first got interested or involved in SRHR advocacy.
Thank you very much, Jeremiah and Amanda. As they've said, my name is Yasmin Mohammed. I work with a feminist women's rights organization called Superb. And how I got interested on matters to do with sexual and reproductive health and rights was informed based on my lived experiences. So I grew up under the custody of my grandmother, where I had, I was by then a young girl, an adolescent girl, and my granny had little information around sexual and reproductive health and rights. So it was really, really hard for her to inform or equip me with information around SRHR upon reaching puberty. So upon starting my menses, that is period, I found it hard to manage my menstruation simply because I had no information at all around matters to do with menstruation. I ended up using unsanitary menstrual products, which were health hazardous to my health. I ended up getting infection. So as I grew up and also growing up as a young adolescent girl, in an informal settlement, I was inspired by my lived experiences and realities around imparting women and girls from marginalized communities on matters to do with sexual and reproductive health and rights, and ensuring that we create an environment that is inclusive and equal, where these young girls can have access to sexual and reproductive health and rights information. So that is what really inspired me to start up an initiative that is called Superb. And I'm really glad that through this initiative, we are able to promote equal access to information around sexual and reproductive health and rights, specifically to women and girls living in underserved communities, as well as marginalized communities. Thank you very much, Jeremiah. I submit. Back to you.
Thank you so much, Yasmin, for sharing your experience with us. Hakim, please also introduce yourself and share your experience with us.
Well, Hakim Kayonga is my name. As I was earlier introduced, I serve the team at Youth Chapter in Uganda as the programs manager on the SHISWAS project. My SRHR journey begins from where I joined classmates. That was about a few years ago when we went to Eastern Uganda basically to do charity-related activities, and they were basically entailed to young people in school. So visiting a primary school where we are doing our activities and then entering a class where we find this young girl who is seeing her periods for the very first time in class. And this lady or this young girl is being looked at as somebody who basically has gotten a challenge, and she also doesn't know what is happening to her at that particular moment, seeing blood on her skirts. And then she also doesn't know what is happening. Surprisingly, even the people around her never knew what was happening. It was sort of a laughing matter to a few that were there. But then I really felt so touched. And then I'm like, if this young girl is facing such a challenge or such a situation whereby she even doesn't know what is happening to her, then it is so touching. It just triggered my mind that very many other people, very many other young girls in such a situation are facing such challenges without having information about that. And in very many areas of the country where I come from, Uganda. And from that day onwards, I felt compelled to actually stand out in solidarity to advocate for young people's sexual reproductive health and rights and its various components in a bid to ensure that young people have equal access to sexual reproductive health and rights in their diversities, because young people are not homogeneous. Until today, I took that lineage. By that time, I was an IT person by profession. It even gave me a niche of going to university, upgrading into humanitarian work and humanitarian related courses that I follow my passion of advocating for young people's sexual reproductive health and rights until today, where I get a chance of serving on the SHISWAS project in Uganda as we impact change. Back to you, Jeremiah, and literally that sparked my story until today. Yeah.
Wow. Wow. Thank you so much, Hakim, for sharing that amazing personal experience. And thank you, Yasmin, as well, for sharing with us. I will come back to you, Yasmin, but first let me turn to Earth. Earth, what are some different ways that youth can speak up and advocate for young people's sexual reproductive health and rights? And can you give us some examples, please?
Hi, I'm Earth. I'm sorry, Amanda, could you repeat the question?
Yes, please, I can. What are some different ways that youth can speak up and advocate for young people's sexual reproductive health and rights? And please give us some examples, if you don't mind.
Yeah, sure. Yeah, there are many different avenues and ways. There's social media engagement and campaigns, there's protests, community gathering and community care, speaking to representatives, writing letters to politicians, getting involved in local organizations. So there's like a lot of different ways. An example I can give is there was a moment in the US where Roe v. Wade was overturned. And so within my community, within Toronto GTA, because we realized that like here, there's like a lot of lack of access to contraception, specifically where I was in Guelph, which is a bit further from Toronto. And so, yeah, so we did things like writing letters to our politicians. We also showed up in protests. So we would bring together community and we would go in front of our city hall and we would do protests. We also did community care aspects where there was no abortion clinic that was in our city. So we would arrange car shares. So we'd be like, okay, who has a car? Who needs access to abortion or contraception or whatever they need from this other place? And we would arrange for them to be driven to the other city with someone who has access to a vehicle. So that's one example. So things like that are ways that like youth can sort of come together with the power that they have to try to create change.
Awesome. Thank you. I'll turn it over to Yasmin. Share with us those different ways that youth can speak up and advocate for young people's sexual reproductive health and rights. And share with us your examples from Kenya.
Okay. Thank you very much, Amanda. So some of the ways young people can speak up and advocate for their sexual and reproductive health rights are: one, they need to engage in or participate in leadership or governance processes, that is through vying for leadership positions, either at school or universities or whatever institutions they're working on. So that is one. Then number two, above everything, young people need to be empowered. We need to have knowledge and information around that particular course. We need to be aware of our rights as well as young people. Then my colleague, my fellow panelist has been able to mention other actions like social media. I won't repeat that. And an example that we had as an organization here in Kenya, during the World Menstrual Hygiene Day, we participated in a call to action activity, whereby on that day we invited media, and we do acknowledge the role of media play in amplifying our voices. So we did a press statement, and the press statement, I'm glad that until today our voices were heard, and as we speak, a motion was tabled to the Parliament or National Assembly in Kenya. And we are glad that matters to do with menstrual health management will be articulated amicably at the National Assembly, which is the national government of Kenya. So through those particular actions, we are able to see some of the policies or legal frameworks being amended as a result of our call to action. So that's an example that worked well for us. But again, above everything, we need to speak up. We need to participate in developmental processes. And I don't want to forget to mention on something. Also, let us leverage on technical working groups. If we've been invited in spaces, let us be confident about joining those spaces and meaningfully engage through sharing our opinions, our views, our perceptions regarding that particular matter. So let us always tap into those opportunities as young people, and let us speak up so that our voices will be heard. Thank you very much, Amanda. Back to you.
Jerry.
Thank you so much, Yasmin and Eth, for sharing those wonderful insights with us. I'll now invite Hakeem to come in and just share. Hakeem, please roughly just share with us any highlight of a common SRHR challenge, need, or desire that you see amongst youth in your region.
Well, common desires that I see young people that continue wanting or needing in my region are first and foremost information regarding health, particularly sexual and reproductive health, because we are living in a region and it is evident that young people really lack access to accurate and comprehensive information about their health, their sexual health, about sexuality and all its different aspects. And it has caused about a lot of issues. Yeah. The question would be, who has the responsibility of making sure that young people have access to comprehensive sexuality education so that they can make informed decisions and choices about their lives. We have basically realized the challenge of high rates of unintended teenage pregnancies and early first child marriages in our region or in the region that I come from. In Uganda today, when you check the rate, it goes up to about 24% of teenage pregnancies, according to the Uganda Demographic Health Survey of 2022, which is also a challenge that is eating us up as the young generation in this particular country. Same applies to the other countries that make up the region. We have high rates of sexual gender-based violence among young people in my region, and this is actually hindering the female gender so much, and it has a lot of things that young people are facing, including abuses, the forced marriages that I've been talking about, things to do with rape, female genital mutilation in different parts of Uganda and Kenya, and so on and so forth. And then when it comes to the laws that are governing us, the legal frameworks and policies, realize that very many countries in my region and in Uganda specifically have very restrictive laws, and some of the laws are not clear. Some of the policies are not implemented, and it's really causing a lot of challenges that are affecting young people. And if there is need to sort most of these issues, probably young people will enjoy their sexual reproductive health and rights, not only in Uganda, where I come from, but in the whole region as Africa at large. Back to you, Jeremiah and Amanda.
Thank you so much, Hakeem, for sharing those insights with us. To our participants joining us from across the globe, do not forget that you can submit your questions using the Ask a Question button, and we'll be able to ask them to our lovely panel. Now, that was a perspective from the global South. I'll turn to you, Earth. What are some of the challenges young people are facing in the global North?
Something that comes to mind for me regarding the work that I've done is there's sort of been a federal defunding of HIV organizations. And HIV organizations do crucial community work and community health work and also sexual health work. HIV organizations do education on HIV and AIDS, and they also do education on sexually transmitted infections and bloodborne infections. They're a space for folks with HIV to receive the services they need. And there's been a shift in federal funding from treatment and support of folks with HIV towards prevention. And even that has been defunded more and more since 2016. And so we see local community health organizations that care for people's sexual health getting closed down and different things like that. We see there's been HIV self-testing kits that you can use at home, and they're also being defunded. These are places that you can access things like PrEP and PEP, which also help with HIV prevention and care. So this has greatly affected youth and our communities. And on top of that, HIV rates are going up in Canada, across Canada, especially within racialized communities. So if we're thinking about African, Caribbean, Black communities, also Indigenous communities, South Asian communities. So this is really affecting a lot of communities across Canada, and here within Toronto and the GTA. And these organizations are also very much based in 2S LGBTQIA+ friendly care. So that's gay, lesbian, bisexual folks. HIV organizations are often a safe space for folks to talk about their sexual health who are part of these communities. And so this is also a part of the attack that there's been within Canada on 2S LGBTQIA+ communities and their education and the spaces that they are allowed to take up, both within healthcare, within school. So yeah, so those are some issues that come up for me.
Wow, thank you so much, Earth, for sharing that biggest challenge from the global North. There's one panelist we are dying to hear from. I'll turn to you, Earth. Please share your personal story or experience as you introduce yourself, but also take on this question. What advice would you give to young people who are looking to access decision-making spaces to ensure their voices are heard in SRHR? Give us your perspective from the Global South.
Yeah, thanks, Amanda. So as I've said, I'm Earth. I'm from Toronto, Canada. I entered the world of sexual health through volunteering when I was a teenager. I was a young person, I was about 14, and I was witnessing a lot of violence within romantic and sexual relationships around me, within my family, and also within my friends. And so I joined a program with Victim Services Toronto called TEAR, which stands for Teens Ending Abusive Relationships. And through that, we did workshops and social media campaigns on things like sexual consent, STIs, so sexually transmitted infections and bloodborne infections. Healthy sexual relationships was a big part of what we did, healthy relationships and healthy sexual relationships, sexual violence prevention. And so we wanted to create a lot of opportunities for marginalized young people to be empowered and learn about healthy sexuality. And so from there, I got involved in a lot of different actions and movements. More recently, I had a role with an organization to do workshops for African, Black, and Caribbean communities, specifically women and gender diverse communities, on sexual health and HIV. And so it's this sort of like peer-to-peer workshops that empower our communities with education. And now I'm on the board with Action Canada for Sexual Health and Rights. And I joined that board when Roe v. Wade was overturned in the US. That was a big thing for abortion within the US, and also just access to contraception in general and like cultural attitudes. So that's when I joined Action Canada. And right now we're creating an STBBI campaign, and that's sexually transmitted and bloodborne infections educational campaign for queer communities to promote testing. So in terms of the advice I would give to young people looking to access decision-making spaces, I would say it starts with mapping out where you are, mapping out your circle of influence. Who do you have around you? What problem do you see? And who can you influence around you? From then, it's sort of like finding out the people with decision-making power. So this could be through research, through literature reviews, through looking at the news, through looking at social media, through like looking into your government structures and who's the minister of certain different issues, the minister of gender, things like that. So you map out who the people with power are, and you find out who you have access to or who you can influence. So maybe you can join a local feminist organization, or maybe you can find out how to join a global feminist organization. Maybe they have a youth program. Maybe you can email them about the issue. Maybe you can start organizing with them. So those are some ways to like start to think about how you can influence policymakers and to make a policy change. And from there, you just have to hone in on your strategy and your objective, whether it be to reform or remove a harmful policy or push for more funding in a certain area. And I find personally the best way to do that I've done that, is through organizations. So I might start volunteering with an organization, then bring up an issue with them, and they'll have connections. They'll know someone in Parliament or a politician that is interested in this issue. Or they'll know a team of community grassroots activists who are already caring about this that I can join and bring my ideas to. So yeah, so those are some ways that come up for me, and I'll pass it back to you, Amanda.
Amazing, amazing. Thank you so much, Af, for sharing. And now I would love to turn this to President Activist of Zambia, Annie Sambu. Please do introduce yourself once again and share with us your personal perspective or experiences, and then let us know or tell us some of the advice that you'd give to young people who are looking to access decision-making spaces to ensure their voices are heard in this space.
Thank you so much, Amanda. So my name is Annie Sambu, and I'm from Zambia. I'm president for Activista Zambia that deals with social accountability and public resources. So I first heard about sexual reproductive health rights. At first, I didn't know that it was actually a right. to have a right for your own body, because sexual reproductive health is the right to make decisions about your own body as an individual, regardless of your race, regardless of your nationality, regardless of your sexual orientation. I grew up in a community where talking about sex was actually a taboo from all angles, whether you're in school, whether you're at home, like the community considered it as a very big taboo. So for me, I was very eager to learn because young girls were getting pregnant, young girls were being infected with HIV, regardless of whether they were male or female, uh, sexually transmitted diseases such as gonorrhea was going on. So for me, I didn't want to be part of that group that was going to be affected if there was a solution. So just looking at how you can actually influence decision makers, it's very important to understand what you're doing as an individual, as a young person. Because young people, in most cases, young people are not in decision-making places because they feel like we are not, um, we're not responsible enough for us to find ourselves in decision-making processes. So it's very important to first educate yourself. Just like Yasmin has said, Akim has talked about sexual reproductive health. It's wide. They've talked about menstrual health. They've talked about contraceptives. Ed has talked about teenage pregnancies. Ed has talked about STIs. So these are some of the things that you need to educate yourself with. You need to understand what is it that is in sexual reproductive health rights before you start involving yourself in decision-making positions, because these are people that are influential and that actually make decisions in our country. So they need to know that you know what you're talking about, because we have a tendency of talking about things we don't actually understand. But as a young person, you need to first educate yourself. Secondly, you also need to build your public speaking skills, because you are not just going to speak without understanding or without having a better approach, because these are people that are in decision making processes and they're not easy people to actually access. For example, here in Zambia, I can't just wake up and say I want to meet the minister. Even if my agenda is very good, it's not possible because they require me to have a certain approach. So you need to understand that part. Secondly, you also need to know what's happening around your area. You need to understand what's going on, like what's happening. What are some of the policies that have been put in place to actually support adolescent health or sexual reproductive health rights? For example, here in Zambia, we have what we call the Health Strategic Plan. The Health Strategic Plan guides us on what is involved in sexual reproductive health rights and what the ministers are doing about it, all these that are in decision-making processes. And then you also need to identify your passion. Sexual reproductive health rights is very wide. You cannot advocate for everything. You need to advocate for what really speaks for you, because even when you speak, it's easy for someone to understand. For example, I advocate for access to contraception here in Zambia. And how do I make sure that that is actually done? You need to ensure that you understand the topic and you also understand the guidelines that have been put in place. For them to it's very easy for you to convince the people, and you also need to understand what documents have been put in place, what needs to be done, so that you even have statistics on your fingertips. And you also need to tell your story, your personal experience. Like all the speakers that were talking about their personal experience. I've just talked about my personal experience, how I involved myself with sexual reproductive health rights. Thank you so much, Amanda. Back to you.
Amazing and interesting conversations here. And now it's time to have your say. Let's get into a couple of questions from the audience. I already have a question right here. This question will go to you, Yasmin. It says, what change do you want to see in terms of the way high-level decision makers engage with youth and youth-led work? What would your message be if you can speak to these individuals today? I'll read that again. What change do you want to see in terms of the way high-level decision makers engage with youth and youth-led work? What would your message be if you can speak to these individuals today?
Thank you, Jeremiah, for that question. So the change I'd love to see a community where decision makers are meaningfully engaging young people in decision-making processes. That is through, since inception of this policy or legal frameworks to the evaluation part till from inception to creating that particular document, to implementing, to evaluation. I'm really looking forward to a community or society where has embraced young people. And for the young people, I want you to know that you have the desire and energy to do something about all these injustices and inequalities we are facing around sexual reproductive health and rights. And you have the power to influence change. So again, grab into those spaces. Then my last word will be, if you are not invited in those policy and decision-making tables, then let us create our own tables. Let us have our own table, then sit and write a statement or petition, then we present them to the right stakeholders. And that is now through knowing your circle of influence and circle of concern and those who have power to influence that particular issue. So that's what I have to say. Yeah, Jeremiah, so I hand it over back to you. Thank you.
Thank you. Thank you so much, Yasmin, for answering that first question from our audience. Our second question, and I'll direct this to Earth. How can youth take first steps to get involved and be leaders in the SRHR space, especially when they face challenges and pushback from communities? I'll read that for you again. How can youth take first steps to get involved and be leaders in the SRHR space, especially when they face challenges or pushback from communities?
Yeah, it is really difficult to try to mobilize change as a young person when you're in communities that don't support that. Folks have mentioned it, but like the first thing is always gathering information on the issue. And through gathering information, you find out who your allies are. So an example is one big issue that I'm facing right now. I work with Planned Parenthood Toronto with their TEACH program, which gives to us LGBTQIA plus education. And one of the biggest challenges we're facing is that schools are getting increasingly homophobic and transphobic as time goes on within this current political climate. And so, yeah, it's really hard to find allies because even teachers and principals and administration within schools are scared of bringing us in for education so that their youth can have education on 2S LGBTQIA plus identity and relationships and things like that. So really, like, one thing that I'm starting to do is like find out who my allies are. I'm reaching out to teachers who are like, this is a problem, this is what's happening. There's students who have like queer student groups, small queer student groups, bringing those students together so that we can start to really talk about what this issue is and we find out who is in on this, like who wants to create change. From creating a small circle of like people who care about you, people who are ready to support you, people who are allies in this issue, then you can have more of a foundation to go out against the culture that's sort of coming back at you and do the work, whether it be like if you want to look at a policy change or if you want to look at a cultural change or if you want to get funding so that there can be organizations that come in to give inclusive sexual health education. You decide what your action is, but that basis is really important. That basis of allyship is really important when you're in spaces that aren't supportive.
Thank you so much, Earth, for that perspective. We have another interesting question from the chat. It says, how do you ensure your SRHR advocacy efforts are creating impact in the community? How do you ensure that your SRHR advocacy efforts are creating impact in the community? Hakeem, would you like to tackle this one?
Well, thank you very much for that wonderful question. I would respond to that by first and foremost mentioning about a little bit about advocacy, because advocacy is a process, and as my colleague mentioned earlier, you cannot advocate for what you do not have information about. So before you start your advocacy, meaning there has to be an advocacy issue. So the advocacy issue informs your advocacy. And before you also do advocacy, or after identifying the advocacy issue, you draw the advocacy plan. Yeah, you have to do monitoring and evaluation of your advocacy efforts, how and why. This depends on the advocacy issue that you're tackling. For example, there might be an issue of limited access to youth-friendly health services, including maybe access to contraceptives. It could be limited access to contraceptives. Let me call that the issue, limited access to contraceptives by young people or adolescents. And then, having identified that as an issue, what is it that you're going to do next? Yeah, you are supposed to draw your advocacy plan. And then it's how is it going to look like? You're going to have to choose quite a lot of indicators that are going to guide you in doing advocacy, but also tracking or monitoring your progress in regards to that particular issue or those particular efforts that you're trying to invest into that. Of course, you're going to have to consider quite a lot of things. What is causing these limited access to contraceptives by young people? Are they stigma-related challenges from young people? Is it that there is lack of confidentiality? Is it that there is the cost of contraceptives? Are they even available in health facilities? Where are they supposed to get them from? Are they even supposed to get them? So this is why you're going to go an extra mile of doing research. Under what policies or what are some of the legal frameworks that are backing up this issue that you are talking about? Because it's different going to advocate for something and you're trying to hold somebody accountable over something that is not their mandate. But if at all we know that it is a right for every adolescent to access youth-friendly health services, then we have to sort of clarify and pick out those policies and legal frameworks that really back up that issue, so that by the time we are doing advocacy, we know the issue is there, whose responsibility is it. We are supposed to ensure that there is, first of all, availability of these services in health facilities, government or private health facilities. At this point in time, I'll look at government health facilities for the issue of contraception. Then accessibility, are these services accessible? Yeah. If they are not accessible, then we look into the issue of how and why. By the time we start seeing change in most of these things, meaning our advocacy efforts are counting, by the time youth are included into planning for maybe these services to be available and all that, because it's all a process. There are different committees at our facilities. They're supposed to be youth-friendly corners. By the time we start seeing change in most of these things compared to our advocacy issue and how the problems were in the first place, then we start counting positive things about our advocacy issues. Thirdly, adaptability. How are youth adapting to whatever is supposed to be there, or whatever we have now ensured that it's available, it's accessible, and then how they're adapting to it, and is it quality per se? Yeah, so we are supposed to ensure all those things before we count our efforts into advocacy, either positive or negative. But as I said, advocacy is not a one or 2 days journey, but then we are supposed to monitor it right away from the start until when the whole big picture is achieved, or the whole advocacy goal is achieved, and that is when we celebrate the major win. But even within the process of advocacy, we are supposed to literally celebrate the wins, and this takes us back to the advocacy plan that we made, because there are certain advocacy issues that are continuous. For example, policy advocacy. Yeah, on certain SRHR issues. And it's not a one-day thing. We all know how our governments operate, more so in terms of policy formulation. Yeah, it is a whole long process. But even making decision makers or policy makers realize the issue, the advocacy issues, and then they start talking about it in a more friendly manner, that's an advocacy win. Because there was a time when the policymakers were not friendly to certain issues, more so issues to do, for example, with self-abortion, issues to do with comprehensive sexuality education, terming it as teaching young people how to have sex. But by the time you unpack it, and then first of all, you let policymakers know about the issue and have equitable knowledge about it, and then they start embracing it slowly by slowly, then we are like, our efforts are counting. Because you might have to advocate for an issue and then you reach at the apex of it, and then there comes another advocacy issue out of that issue. I'll conclude by sharing an example from the Ugandan perspective. We have been advocating for so many SRHR related policies, including the adolescent health framework, the renewal of the national strategy to end child marriages and teenage pregnancies of 2022. But guess what? After advocating for so many policies and we celebrate them as a win, this is where the government comes up to say, no, we are having a lot of duplicated policies in Uganda. And now, Ministry of Health, what you're going to do, you're going to consolidate all the health policies in one policy, which is the National Health Policy. And now they're in the process of consolidating all these policies into one policy document. Now we are going back to review and to ensure that in the process of consolidation, no information is left out in regards to whatever we had advocated for earlier as policies, because we're supposed to ensure that the policies that we advocated for earlier, the information that is embedded in it, all at least is captured somehow, somewhere into the national health policy, so that we do not face the same issues in future as we faced before maybe we are putting those policies in place. And maybe we're like, if at all the policy will look so big, like maybe a university book or a Bible or a Holy Quran, okay, let's do like this. Let some of the policies actually become strategies and guidelines, other than entirely losing them in the names of the policy will look so big. Because by the time we put them in place while we're advocating them, we saw the need for them to be available. So that was one thing I wanted to share, that at each and every advocacy step we go to, of course, we are supposed to, or we celebrate certain wins at that level. Because even having a major duty bearer or policy makers stand out in solidarity, for example, a legislator or parliamentarian, stand up in solidarity to sort of defend an advocacy issue, or talk about an advocacy issue that looks like a taboo before all the other legislators, that is a win, because we are having an ally at that level that might help us actually pass the agenda, and then we have more healthy laws that are going to support the SRHR work we are doing.
Thank you,
Otherwise, that
Hakim.
is it I can say about that. Back to you, Amanda and Jeremiah.
Thank you so much, Hakim. That was super, super detailed. And we thank you for that. Our last and final question for this panel is going to you, Annie. In just a minute, do you have ideas about how youth-friendly approaches like technology and digital platforms can be used to improve access to sexual and reproductive health information and services in underserved areas? I'll read that one more time. Do you have ideas about how youth-friendly approaches like technology and digital platforms can be used to improve access to sexual reproductive health information and services in underserved areas? Annie?
Thank you so much, Amanda, for that question. So we live in a digital world, and it's very important to actually consider digital, or let me say social media and other technological platforms in advancing our work in sexual reproductive health, right? Especially in rural areas. So sometimes what we can do is you can actually have online campaigns on the advocacy of a certain cause. For example, maybe let me say access to youth-friendly, the youth-friendly services. So if in a certain community we do not have proper access to youth-friendly services, sometimes we do have youth-friendly spaces, but the services are not youth-friendly. We can actually advocate for that online, because online you have a lot of numbers and you also have a lot of allies. It's easy to identify allies online, people that are actually championing the same agenda. It's also easy for us to recognize other networks or other networks or other youth friendly spaces or other NGOs that are actually fighting the same cause as us. Some of them have already reached an advanced stage that can actually take the petition. And sometimes we actually do target decision makers. We actually target decision makers using online platforms, because sometimes they're not reachable physically, or they keep on telling you, I don't know how other governments are, but like in my country, you can take letters, sometimes they're unreachable, you can't find them, they are busy, or the letters will still be with their secretaries. But if they see that something is popping up online, it's very easy for them to see it and actually address it, because social media plays a very critical role. So you need to have campaigns, you need to inform other allies, and your campaigns need to be very brief. You need to identify the issue of it. So even how you design your message is also very important. It needs to be very catchy and very attractive. And I'm sure also you can also help by sharing personal stories that are attached to the cause that you're actually fighting for. Because that way it's very easy for people to get stories and also understand, to say that there's something that is wrong somewhere, because young people are affected. We are the future of, they say we are the future of tomorrow, but for me, I believe that there's no future tomorrow. The future is now, and young people are the most population in most countries. So it's very, it becomes a demand, and something is usually done. And like I said earlier on, you cannot do advocacy as an individual. So when you have a group of people talking about the same thing, then yes, something is really going on. So social media is a very influential tool that we can use, especially if we cannot reach our leaders physically. Thank you so much, Amanda. I've answered your question.
Thank you so much, dear panelists, for those educative and informative conversations. It is now time to move into our breakout rooms